Rural health, and particularly Native American health, have some of the biggest health disparities in the country. And so, for example, lifespan in Native American communities is up to 15, 20 years less than in other communities. And so those are really important critical health disparities for us to address and understand and work with the communities to help solve.
There are 8 reservations in Montana and 12 tribes. They have a lot of differences when you think about some of the ways they approach culture or language, but there's also many similarities. One of those similarities is health disparities. Indians in the United States live 5.5 years less than the average population. In Montana, we live 20 years less, an entire generation. So we need to do something in regard to health. There's a dire need for adequate health care.
The Center for American Indian and Rural Health Equity, we call it CAIRHE. It is a center that is funded by the National Institutes of Health and is designed to really create long-lasting, trusted partnerships with rural and Native American communities across the state and beyond in order to improve health equity for those communities.
I'm a member of the Blackfeet tribe. I'm a mother. I have 2 daughters. I'm a grandmother, and I have 10 great-grandchildren. So it's really important to me that research is done in a respectful way. And in doing that, I think that if they use something called a 3 Rs, that they first develop relationships, and that takes a long time and a concentrated effort. Secondly, that they do that in a respectful way. And last but certainly not least, that they remember reciprocity.
Respect, relationship, and reciprocity are really important concepts that we want to get across in terms of how we work with communities and how we train investigators to work within communities. So Turtle Island Tales is a family wellness program that we've developed over the past 15 years that aims to improve wellness, mental, social, physical, and emotional wellness for Native American families with young children ages 3 to 7.
And it targets a variety of behaviors. So your traditional targets of things like diet and physical activity, but we've also included healthy sleep and emotional regulation as part of this program. We really did a lot of work to revise and rebrand the program and make it more attractive and more appealing to families. And part of that, part of the revision of the program was the development of a character. So this is Igmu, and he's really there to help families engage with the materials. So every family that participates in the program gets this puppet. He's also featured in a lot of the printed materials, and I think that's helped to make this a successful program for families.
So CAIRHE partners with many rural communities and different organizations. One of our best examples is Dr. Scott Monfort's research to understand the high rates of osteoarthritis in Montana's farmers and ranchers.
Agricultural workers, particularly ranchers, are at an increased risk for osteoarthritis at the hip and the knee, maybe 2 to 10 times as likely compared to non-agricultural comparatives. And that can start to increase risk even with 1 to 5 years in the industry. And so it's a population that really is overrepresented in terms of the burden of osteoarthritis, but also is relatively underrepresented in terms of the research inclusion for our biomechanical studies.
At the beginning of the COVID pandemic, CAIRHE partnered with the Confederated Salish and Kootenai tribes on the Flathead Reservation in Montana, ITHS at the University of Washington, and the Yakima Valley Latino community to improve home-based testing in rural communities.
I'm an enrolled Confederate Salish and Kootenai tribal member that has a very long history in working in Indigenous health. I've had many high-profile jobs, worked for my tribe for many years. So when the COVID pandemic hit, I knew that it was going to be harder on Indigenous people. But because CAIRHE had the foresight to go in and really begin to look at it early on, we now have rich information about what was troublesome for people, what was hard for people, what were the obstacles for people. And in just the last couple of weeks, I have met individually with the CAB members that helped oversee this whole project at a community level. That information is now going to be translated into a paper that the community will get to read and to understand.
In order to support CAIRHE, we need partners. We would love to have more donors and foundation funding, because that would really help with some of the dissemination work that isn't paid for as research, but is sort of the next step of getting that work really out into the world. I think the other thing is for investigators to find us and be able to offer them particular training. We're really excited to continue our important research partnerships with rural and tribal communities and really disseminating our interventions to other communities more broadly in the future.